Thank you for that lovely introduction. And it's lovely to be here. I've never given a talk in a ballroom before, so this is a first, and it's very sparkly, very nice. So I'm delighted to be able to talk to you today, and I'm basically going to be offering some reflections that come from around 20 years now of looking at the relationship between public health evidence and policy, and increasingly also looking at the way communities and practitioners feed into that. So I'm going to start with a graph that probably looks quite familiar to many of you. So this graph is showing what we've seen over a long period, is that we have extensive health inequalities in Scotland. So it comes from a Health Foundation funded review produced by colleagues at the University of Glasgow. But what's worrying about this graph is that, as well as this typical pattern that we've come to recognise, we're seeing that a key health outcome, in this case it's male avoidable mortality rates, are so much worse for the more deprived communities, and that we see a gap between each quintile of the population. But what's a bit particularly worrying about this graph is that things have been getting worse since 2014. I know many of you in the room will be familiar with this story, and that part of the reason they seem to be getting worse is that things are getting particularly worse in a very marked way for the most deprived communities. So it's not a positive story in this level. And indeed, Michael Marmot summed it up as Britain is a poor, sick country getting sicker with a few rich and healthy people. And I know a lot of you in the room will be here, partly because you want that to change. That's only why I'm in the research that I do. I want health inequalities to be reduced, and I think health inequalities will only be reduced by tackling wider social and economic inequalities and policy issues. So many of us are coming from that space, and there's been a huge amount of policy activity and research in this space over the last 25 years. So this year marks 25 years of devolution in Scotland. So 25 years in which, compared to England, I'd say there's been a more consistent focus on trying to reduce health inequalities. There's been a lot of policy activity, a lot of strategies, several inquiries, a lot of syntheses of the evidence. So lots of activity, and yet we have the situation of widening health inequalities. So I want to reflect on why that is, why we haven't made the progress that we'd hoped to see, despite the massive evidence. And the UK really is one of the leaders in doing research on health inequalities and ongoing policy activity. And I'm going to go through 6 factors which I think are an issue. And happily, because I like a bit of alliteration, they all have a P to help me remember them. So the first one is policy paradigms, and this has already come up in some of the discussions that I've been part of today. So policy paradigms are, and they can also happen in any organisation, they're a particular way of thinking where you start off down a particular track, or your organisation does, and you go on in that direction, and then it becomes hard to take a different path, or even imagine taking a different path. And one of the ones that comes up in Scottish government policy discussion is a traditional focus with economic growth, national economic growth as being the fundamental policy priority, which can crowd out other discussions, particularly discussions when you're trying to think about taking a more preventative approach that can be difficult to demonstrate the impacts and then to cost those impacts and show how much money you might be saving. And that there have been various policies in Scotland, including this commitment to being a wellbeing economy, that have tried to move us away from that a little bit. But fundamentally, that commitment is built into agreements that the Scottish Government has signed up to, including with the UK Government, which make it very difficult to move away from. So for that one, I think, in evidence terms, we have to think about how we work with that paradigm. Other paradigms, I think we can make more of a difference. So silo-based policy making has been an issue for a long time. It was very much a feature of the discussions that I was having around drugs in the last workshop just now. So silo-based policy making, I'll say a little bit more on the next slide, but I think we all know what we mean. But people are organised into teams that have particular focuses on particular policy issues, and it can be really hard to work across those, even though we know that it makes sense to do so. And then the third issue I'm going to touch on a little bit more later on in the talk is what I call governance by metrics. So this is the importance that when making policy decisions, we often attach to numbers. And numbers can make us all feel a bit more reassured. They seem kind of concrete in some way, so they can give us confidence in making difficult policy decisions. But because we have this kind of focus on metrics, and you see it in the plethora of data dashboards that we can see arising now, it can be really hard for other types of evidence that bring in more qualitative lived experience perspectives to land and to mesh in that kind of metricized environment. So I'm going to talk a bit about that too. But just on this silo-based policymaking, because this is one where I think we can all make a difference. So I am currently co-leading a new unit funded by the Health Foundation called the Scottish Health Equity Research Unit. And we were doing an exercise to map who all of the different stakeholders that we wanted to engage with were. So we had a Miro board, which some of you have probably used one. If not, it's a bit like an electronic kind of post-it note board. And we were mapping them out. And pretty soon, it looked like this, basically. Clusters of people producing research or doing policy influencing work or making policy in a very topic-based way. So there's one on health policy, one on housing, one on children and young people, one on employment, and one on economic policy. And very few people working across these silos. So it's not just the organisation of policy, it's also what goes on around that, the research that gets done and the policy influencing work that gets done. And as I say, I think we can all make a difference. That's one area that Shira is trying to make a difference. So we're trying to link across housing, economy, and health in particular. We're trying to make sure that all our evidence integrates qualitative and quantitative. We're hoping it makes a difference, but we'll just be one organisation trying to make a difference. I think we all can make a difference in relation to silo-based policymaking and practice. So the second issue is the depth of poverty that we have in Scotland. So I'm just another couple of graphs that come from that same review that was on the first slide. So undertaken by University of Glasgow colleagues. Showing again, so this one on the left, we've got drug deaths, and on the right, we've got babies born at a low birth weight. And we see the same pattern of things getting particularly worse for the most deprived communities. And these kind of graphs, this kind of quantitative data are really, really important. So I don't want to undersell their value. They're really important in helping us understand what's going on. But what they don't tell us much about is what's going on in the lives of people in those most deprived groups. And there, I think qualitative research can be more useful. It delves into the lives behind the numbers. And although each qualitative study in itself can often be quite small and tell us something in-depth about a small community, we actually have a lot of that type of research in Scotland. So when we synthesize it all together, bring it all together, we can see that there are actually emerging patterns across these qualitative studies of what's going on in people's lives. We can see the intersection of a range of different issues. And all of this tells us a bit about why those numbers, why we might have that sudden widening gap. The third issue I want to reflect on relates a bit to this, and this is what I call the public health evidence lens. And it's the preference that a lot of people in public health have because of the training that we provide and so on for quantitative data. So public health researchers tend to like bar charts and line graphs, and this is an example from the COVID-19 era when they were being regularly updated in a public-facing kind of way. But this type of evidence, and it relates to something that, a comment that was made in the opening remarks today, they work for some people, so they're really persuasive for some people, but they're not really persuasive for everybody. And I was researching a few years ago, I was supervising a brilliant researcher called Alexandra Wright, who now works for the Scottish Government, and her research was looking at how Scotland's alcohol strategy was being implemented. And she spent some time with local area licensing boards. And one of the things, this is just an illustrative quote, but this came out across the licensing boards that she visited, was a sense that public health evidence wasn't landing very well. It wasn't making much of a difference. And so this licensing board member shares this reflection. And this was at a time when licensing boards had only recently been asked to consider public health in making their licensing decisions. So he said, at every meeting, the police, the building control, the licensing guys, and the health are expected to be there because they can raise their objections. Unfortunately, the health guy just reads out everything he's written, and that's it. They're thinking, I've read this, I don't need to see it again. He means the members, and that frustrates me. A trivial point, but it just annoys me, because that's your opportunity to say, yeah, you put it in an official document, now tell me your story. Tell your story about how that's going to damage people in your community. That's his opportunity, and shrugs his shoulders. And I think because we tend to be trained in thinking about numbers and the credibility of numbers. We sometimes forget about the centrality of stories and the importance of stories in how we communicate information. And this is not to blur the line between fact and fiction, between truth and fiction. Again, going back to the opening remarks made this morning. But it's about how we communicate what our evidence and our data are telling us. And I put this visual up, and many of you will recognize that this is a depiction of Little Red Riding Hood. So Little Red Riding Hood is a story that I'm sure most of you are familiar with. It's a kid's fairy tale, but it's a kid's fairy tale that appears in different communities around the world, so it's one that really has had a lot of reach. Very similar versions with happier or more gruesome endings. And my friend is researching this, actually, the way in which this story is spread around the world and why it's spread. But one of the reasons people think that this story has spread is because it's a really important communication tool with young children. It's telling young children, not everybody is who they appear. Some people might appear nice, but might represent a danger. It's an important message to get across to young children. And so I was talking to that friend and I'm thinking a lot about stories, and then soon after I read this book, How to Fight Inequality by Ben Phillips, and he makes a similar point. So he says there's a tendency amongst some progressives to see themselves as the people of reason over emotion, the people of numbers and facts over myths, and we need to get comfortable with conversations which not only make people think, but which make people cry, make them laugh, which make people angry, hopeful, excited, and determined. We need to be not only teachers for a smarter world, but preachers for a better, kinder, happier one. The fight against inequality is not only rational, it is beautiful. And some people will like this quote and some people won't, but and you can see yourselves in different ways, and you might be someone who much prefers numbers and finds them much more a reassuring way. And I'm not saying, I don't want to challenge that. I just want to challenge the way we communicate with numbers to a wider audience. And I also, just to kind of make that point a bit more, want us to reflect on some of the literature that is out there that is fictional, but still maybe tells us something important. So Shuki Bain is a novel I'm sure many of you have read. So it is a fictionalized account, but there are some aspects of this book which I would say get at a truth in a kind of way better than some numbers do. So what you get from reading this book is the sense of how the interaction of different factors connecting poverty and addiction can impact on a child's life and the family situation. You get a sense of how, despite all the dismality of this life and how difficult it is, what a difference humor and hope can make. It gives you a more rounded sense of what somebody's life might be like than often some of our bar charts do. I am, again, not saying that we should move away from bar charts, but I think we should all be thinking about the craft of telling stories and that bar charts don't speak for themselves. Somebody who I think has done this quite well, and it's partly because he's able to draw on his own life experiences, is Darren McGarvey. So I think he's really good at that craft. He's perfected it, and is a lot more persuasive and effective than I think some researchers are. So it's something that I and colleagues on the research side can think about and improve. The fourth is power and politics. And these are just a load of headlines that remind us that MPs, politicians, all the time, particularly at national level, are getting inundated by interest groups that are trying to influence them. And they may be more or less influenced. And in public health, there's a research group called Spectrum that have done a lot of work on commercial determinants of health in the UK. There's a bigger body of research in that area, but it tends to focus on tobacco industry, alcohol industry, and unhealthy food industry. It tends not to be connected with all the research on the more social and economic determinants of health. In people's lives, when they're talking qualitative research, you see how important those connections are. So again, on the research side, I think we can get better at making those connections. The fifth issue, I think, is a preoccupation with problems rather than solutions. And this one's challenging, right? Because I think it's much easier to study what has happened and what the problems are than to do research which has got a solution kind of focused. And I've reflected on this a lot. I remember when I was doing my PhD research over 20 years ago, this book called What Works in Tackling Health Inequalities came out. And I was so excited about this book because I thought it was going to be a really clear account of what works in tackling health inequalities, and then people could just get on and do it. And that's not what it is. It's a very good book, but it's mainly an analysis of the problems. And I've written books myself that I think are good books, but they're mainly focused on the problems. So Health Inequalities, Critical Perspectives is a book I edited, and I'd say it's firmly in that genre. There's a new one coming out this year by David Walsh and Jerry McCartney. I think it's an excellent book. They've sent me an advanced copy of it. It's really important in showing how austerity impacted life expectancy in the UK. But again, it's thinner on the solutions. I've tried a little bit, having reflected on this, to move into the space of doing research which has more of a solutions focus. So one of the things I did was work with third sector and public sector organisations in Halton in the northwest of England. They got in touch with me, having read some of my research, and we basically workshopped over a series of events a way of moving away from thinking what's the problem, what do we do about it, to more thinking where do we want to get to, let's work back from that and think what changes we would need to make to get there. And it did identify different types of policies and practices. And the second way I've tried to address this is by working with colleagues Claire Bamber and Julia Lynch. So we've got a book coming out next year where what we tried to do was look at all the examples where those line graphs that I've showed you tell a more positive story. So where are there big examples where actually health inequality is reduced over a period of time? And what were the policies that were put in place in those contexts? So the ones we look at are Brazil from about 2000 onwards. We look at the United States in the 1960s. We look at England from 1997 to 2010, and we look at Germany post-reunification. In all of those examples, you see health inequalities moving in the right direction. So generally, health indicators are improving, but health inequalities are being reduced. So we look at what mix of policies did those 4 countries have, and what's similar about those mix of policies. Like, it's far from perfect, because especially the Brazilian and the German example, those policies were not put in place with the intention of reducing health inequalities, so the data that you might want to have is not available. But I think when you put those 4 case studies together, you start to get a picture of the mix of policies that might help reduce health inequalities. The 6th issue has to do with members of the public, or at least people's perception of members of the public and what they will and will not support, and then the research evidence that tells us a bit more about that. So one of the things when I was first doing research as part of my PhD, where I was looking at how evidence on health inequalities gets into policy or not, one of the things that people kept telling me was, well, the key issue is that the public won't support these kind of policies. So the research tells us that we need more upstream kind of social and economic policies that are going to make things a bit more equal, and the public just don't support that. So it doesn't matter how much evidence you have, we can't implement those kind of things. And that researchers and policymakers and politicians all said that. It was a fairly widespread view. And there are survey data, more recent survey data by the Health Foundation that seems to back that up and seems to suggest when people ask about health inequalities, they talk about different, like postcode lottery in health services, and they talk about behavioural issues, and they don't really understand the social determinants of health. I think when you look at the qualitative data, the way people have had longer to have a conversation about what's impacting on their health and their well-being, it shows that they've got very sophisticated understandings of social and economic determinants of health. So I think part of the problem is that we have these kind of clusters of research, and I'm going to show a couple of these bibliometric network analyses. So this is kind of looking at research that cites other research and how that gets clustered. And what we see on this one is that there's a big cluster of research that's all about getting evidence into policy. And then there's a smaller red cluster that's about public engagement in policy. And those hardly overlap. I think that's a problem, because I think we want policies that are evidence-informed, but also informed by an understanding of what members of the public want. So I really want us to kind of join these up. And then the smaller cluster still is the political science people who tend to focus on interests and how they're shaping things, which again is part of the picture. So this is a different bibliometric analysis. It's the same thing in terms of, I mean, I know it looks a bit different because it used a different program, but it's still looking at what research is, how research is clustered when you look at citations, so who's citing who. And here we were looking at research on evidence cultures. And this was really fascinating to me because in this previous slide, a lot of the research that focuses on evidence use in policy is undertaken by people whose interest is health. So they focus on health evidence in policy. In this bibliometric analysis, we see the health on evidence cultures. The health cluster looks small compared to these other evidence clusters. And it is also not well connected to the other clusters. And when we got into the depth of this, that is because the health evidence culture literature looks so different from the other ones. So health tends to have this preoccupation with getting evidence into policy or practice in a very expert-led way and doesn't pay much attention to members of the public, community engagement, and so on. If we look at the more kind of climate change, environmental sustainability literature, their main focus is on engaging with communities and people who could actually put policies into practice. So the gap they focus on is between the policies and the frontline practice. So it's a very different gap to the one the health researchers are focusing on. And again, I think that's part of the issue, and we need to focus on both. And so if we actually look at, as I said earlier on, we try to say, okay, so each individual qualitative study is probably quite small, but if we bring them together, what does that tell us about, for example, in this case, public understandings of health inequalities? And I've tried to answer this question in a number of ways. So first, I've done 2 reviews where I tried to synthesize existing qualitative evidence, one focusing on the UK and one focusing more recently, specifically on Scotland. And as I say, I think when you bring them together, they tell you quite a lot. And then the other way in which I've tried to do this, answer this question, is to run some citizens' juries, where you bring members of the public into conversation with policymakers, practitioners, and researchers, and you ask them all to have a conversation about what should be done to tackle health inequalities. If you do look at those kinds of methods, use that kind of more qualitative approach, then what you find is that members of the public, particularly if they have experienced disadvantage, consistently demonstrate they have a good understanding of how social and economic factors shape health, so the way things like poverty, unemployment, insecure income all impacts on health and how these interact. It also demonstrates, the way these different issues interact and affect people, the way different systems sometimes don't interact, and we were talking about that in the workshop that I was at earlier, so the way people can fall between systems, and the way in which people's different identities intersect to shape their experience, what we call intersectional inequalities. So I think they're really powerful when you join them up in that way. And then I want to end by kind of saying, okay, so if we reflect on all that, then what should we do, especially on the research side where I'm situated? So I think the first thing is we need to get better at this cross-disciplinary mixed method research. There's a lot of funding out there for this kind of interdisciplinary research. I've been part of big programs, but it's really hard to do well. It's really hard to do it in a way that isn't just actually that person over there is going to do some quantitative stuff and this person over here is going to do some qualitative stuff. It's really hard to bring it together. I think we have to think about how we're communicating our evidence, and I think that involves interacting with a lot of different audiences. So one of the things that I did earlier in my career was I was involved in some research looking at how tobacco companies try to influence policy. And that was really insightful for me. So they do not have a lot of public credibility. One of the ways in which they try and influence policy is to try and work widely through a lot of different routes, so that it looks like to policy people on the receiving end that actually there are lots of different organizations saying that we should do this thing. And I think sometimes in public health research, we're not very good at that. So we tend to think if we just get this research and it's really good and we find the right person, then that's enough. But actually, you've got to build coalitions. The third thing is thinking about communicating even more diversely to broader audiences, including members of the public. And I think they're thinking about the craft of storytelling, I hope I've persuaded some of you, is really important. The fourth thing is to have this focus on solutions. So I think you've got to have a focus on solutions if you want to make a difference, but you've also got to have a focus on solutions if you want people to have a sense of hope, a sense that it is possible to reduce health inequalities. It's not a case of things always getting worse. And then the fifth is to pay more attention to public perspectives, public understandings, and what's going on within communities and the changes that people would like to see and how that relates to the evidence that we're developing. If we can show that something has strong community support, a strong evidence base, and it would be likely to save money over time, then that feels like a really powerful place to be when it comes to evidence-informed policy. Thank you very much.
Multidisciplinarity has been always something I would, I think is fantastic. I try always to achieve, and I've written several pieces of research with people who are not economists or But I always found it extremely difficult to interact with people. Okay, now, finding a partner in research, I think, is more difficult than finding a wife. So, in a sense. So, I'm wondering how to solve that problem. Okay.
Yeah. So yeah, I mean, I agree. It is really, really hard, especially for disciplines that are further apart from each other or that have particularly tight disciplinary training. I was trained in geography, right? So it's a pretty broad discipline. So I think I would say a couple of things. I think geographers are helpful because they've been trained in disciplines where there is a mixture of methods and philosophical foundations. So I'm going to put a flag up for geographers, even though I don't identify as one anymore. And the second thing I would say is I think it's really about, you've got to build the trust, and you've also got to get over some of the fundamental issues around language, like using the same terms to mean different things and using different terms to mean the same things. And so I supervised a brilliant PhD a few years ago that was on exactly this question by a woman called Taya Collier. And so, she was really taken by the work of Thomas Kuhn, and that's quite a depressing account, right? He basically says you can't really have interdisciplinary work unless you spend maybe 20 years in a room together and you sort of bottom it out. I am a bit more optimistic. I've been involved in some research recently where it's worked better, but still been hard. And I think combining it with a solutions focus has been really helpful. So if we're all trying to figure out a solution, like what are the different bits of the puzzle that we can bring, that has felt like a more productive space than trying to analyze the same problem in different ways. That's one suggestion. I think the other is just time and humility, right? I think we all have to come at these things not hanging on too much to the way that we've been trained, but being a bit humble about what we know and don't know.
Hi. I love the fact that you're publishing a book that tells some good news stories. And wondered if you could give us a synopsis of two of the countries that you mentioned. Thinking about the forthcoming election, the US example, what you saw as evidence of or the interventions or context that were narrowing the gap in the 60s, and also England, where you highlighted a more recent time frame.
So what you see in both of those examples is an investment in public services, and you see some kind of what Brazil called pro-poor cash transfers, but they're not always cash transfers, but kind of changing the tax benefit security system in order to try and make things more equal. So both the US and England tried to do that a little bit. Actually, the better examples there are probably Germany and Brazil. But that was an important feature of all four. I'm like moving away from your suggestion that I focus on two of the examples. I'm more focusing on what were the things. If you look across all four, what were the things? So there was investment in public services, and there was kind of a pro-poor kind of cash transfer system of some kind. But I think what was also clear was that there was a push towards engaging with communities and giving people more ownership over the decisions that get made that impact their lives, and trying to connect up kind of various different community activity to influence policy. That was particularly strong in Brazil, right? And all of those four examples, right, I suppose the disappointing side is that they all run into problems, and then you see a waning of those kind of approaches. But when you look at some of the qualitative evidence from those periods, that what seems really important is that connecting communities into the decisions that gets made. So it's not just about taking the evidence and saying, we think this will be effective, we think it'll be cost effective, let's do it. It's about saying, actually, we're going to invest, so let's have a conversation with the community about the changes that they would like to see. Or and in Brazil, they tried to do that at multiple levels, so at very local levels, but regional levels, and then also nationally to hold forums where they fed in. And obviously, Brazil experimented with participatory budgeting, which is about trying to bring citizens into that conversation. That was one of the things that I took away, and I've answered a slightly different question, so I'm sorry about that.
Hi, thank you for a really engaging and interesting seminar. I'm Rachel from North East Scotland Climate Action Network, and I hope this is a question, but it reminded me very much of what you, about the difference between deficit-based community development and asset-based community development, and the recognition that the solutions are actually within the communities, because we always seem to talk about communities as something other from ourselves, and we do a lot of community assembly and deliberative democracy type processes within communities, and the answers are all there. And if we could have a much more bottom-up form of democracy, it's less easily hijacked by the corporate vested interests, and it would be great to have a conversation with you afterwards. I don't think that was a question, I'm really sorry, but asset-based community development.
Okay. Hi, I'm Anu Kasim from the Royal Foundation, and my questions around solutions and storytelling, I'm very interested around that concept of storytelling. And I guess for me, it's just wanting to hear more about examples of successful situations where the voice of lived experience has been part of storytelling, but how to create and communicate value back to those who are bringing their stories to the table. And just wanting to know more on how to kind of develop a proper storytelling / mixing in with your decision makers and your operational folk and putting that together.
Yeah, that's a really good question. And I think the best example, so most people I see who I feel get policy traction and become influential in policy settings are good at telling stories. They might also be good at doing quantitative analysis. But when I see them talking to politicians, the thing that gets traction is the way that they can tell and perform a story with the evidence that they've got. The most effective example that I've seen of kind of stories that are more about people's lived experience and that influencing policy and practice. So I went to a Police Scotland training event, and there were a couple of people that had experience of involvement in the justice system sharing their stories, and they were really powerful. They were really powerful accounts about how many times systems didn't work, and they fell between and got moved between systems because of things like they were experiencing mental health and addiction issues, but services were set up to only treat one or the other and not to be able to cope with both. But what was also really powerful was that they both the speakers at that event gave an example of where somebody in the system, in one case it was a prison officer, in the other case it was a police officer, or a group of police officers, had intervened in their lives that transformed things and turned things around. And you saw how when they told that story, that sense that you could be that person or part of that team that made a difference to that person's life and turned things around for them. You could kind of see the power of that story. And there had been a whole lot of different types of evidence at that event, evidence on kind of bar charts and line graphs, the extent of the problem. There was evidence around the cost of the problem, which is also a really powerful lever. It was when you combined it with those kind of lived experience stories that I really felt like things started to move up a level in that room. So yeah, that would be one example. But your second part of the question is a really important one, I think, because those two people, I don't know much about them, but I had the sense that they'd almost become professionalized into kind of sharing their lived experience accounts. And I don't know how that is for them, on how much kind of feedback they're getting for doing that, for having to share that story again and again. I know that in the qualitative research, and one of the reasons that I try and synthesize and think, what can we learn from this existing research, is because I think it is really problematic if you're going back to communities that are disadvantaged in different ways and doing more and more extractive research and asking them to share their stories again and again, and yet you're not seeing the change at the other end, because people talk about that being re-traumatizing, and so that kind of that loop at the end that you talk about feels really important. I've seen less really good examples of that, I would say.
We've got time for a couple more questions. One here, and then
Hi, I'm Irene Buteman, and I've been leading the Shaping Places for Wellbeing programme in Scotland jointly by Public Health Scotland and the Improvement Service. We've come up against this exact issue in our work locally, feeling that that capture of lived experience is potentially not always robust in how it's because it's one person's experience. And also feeling that we have every organisation here, potentially councils especially, health boards, have frontline workers who have that qualitative, rich information about what those experiencing inequality are facing, what they need from their places and so on. And we worked with those frontline workers, third sector, community groups, councils, health boards, to garner that community insight, is what we called it. Is that something you've been aware of happening elsewhere? Because I feel we're just missing a huge opportunity where it takes time to build trust and capacity with a community, but especially a deprived community. And yet we have frontline workers who have built that trust and that capacity, and we're not garnering everything that's in their minds around what's happening.
Yeah, I think that's a really good point. So in some of the qualitative research that I looked at was looking at kind of practitioner accounts, sometimes as well as community accounts. Sometimes that was the route to kind of getting a sense of what was going on in the community. And I think that is a really good route into avoiding some of the issues that we talked about. I think where it is worth thinking about community engagement is when the conversation is more actively about the solutions and the changes and how that might actually work. Because I think then if there's a genuine commitment to doing something different, I think that can make a difference in that democratic sense. If people feel that they've actually actively been part of the conversation that change things, that can be a real positive. But I think we do have to think really carefully about what we're asking from communities that are already carrying a massive burden of all different kinds.
Thanks very much, and thank you very much. It was very much a different tone, having that positivity and finding solution. But you touch upon it, of what you just said, that community engagement. How can we have a way to engage the community, to give them the space, as you said, to make sure that they can express their anger and they express their trauma in a safe place? And I don't think we've been good at that. I think we have been far too positive in our approach and talking about good storytelling, and we are moving far away from the reality where our community is living and their own experiences. So how we can value the experiences of our community and put them up there in the discussion without causing extra trauma to our community? How can we maybe lower down the expectation of ourselves, difference we can make, and for our community, or what can change we can make to help them, moving forward? I still find there is too much disconnection. I don't know if the example you talked about found that way to engage better with our communities, but I've got to say we are struggling very much.
Yeah, I mean, I think it is really difficult to do well, and it's also really difficult to get conversations that kind of end up in a place where you reasonably can kind of act on the insights that you get. I think so that being kind of upfront and honest about the limits of your power to change things feels like a really important part of that. So I was involved in some citizens' juries as part of that Spectrum collaboration recently, and we ran 2 in Glasgow in different areas. One where there's a massive oversupply of alcohol and tobacco and unhealthy food, and one where that's less the case, a bit more mixed socioeconomically as well. So we ran them separately, and then we brought them together, and we brought policymakers and researchers working across different levels into the room. I feel like we did it over quite a long period of time, so it took place over a period of months, and we were reworking with the same group. That helped because we could make space to have those conversations about the reality of people's lives at the start and do more listening, but we could then go on a bit of a journey, and we also had time to, we didn't dismiss like the really radical solutions like let's let's just ban vapes tomorrow and stuff that like nobody was going to be able to implement that. So we had space for people to put those things out there. But actually, a lot of the time, I felt like the suggestions people were making were they weren't asking for very much. They were quite minimal. So it tended to be very radical and then a bit like not so radical, but might not make much of a difference. And so then we had to do quite a lot of work kind of with people sort of working through that theory of change almost, like, so if this happened, then what next, and why this one versus that? So it was working over a period of time, very gradually trying to get that sweet spot. It was being very clear that whilst we couldn't commit to implementing changes ourselves, we could bring them into conversations with policymakers across different levels, which we did do successfully. And I mean, we've yet to see what impact that made. And maybe it won't make much. I'm meeting the Scottish Government on Wednesday to see what they are going to say in response to coming to that meeting. They seemed like they were very engaged with it, but I did leave it feeling like the public were way ahead of the policymakers in terms of the kinds of changes that they wanted to see. But yeah, we were up front from the start, and people seem to enjoy that process of just moving from a conversation about a problem to what solutions might look like. They enjoyed the opportunity to meet with decision makers. Yeah, and it's not perfect, but I feel like it was better than many examples that I've seen.
Well, thank you very much, Kat, for an excellent presentation. And can we all